I'm wondering about your recommendations for therapists, because with veterans sometimes it takes work or it takes time to help them speak, articulate very difficult experiences, especially to talk about their emotions, their feelings. And we as therapists, we want to help them, and we want to get to those things, but they're very difficult. In many cases, it can take a long time before a veteran can open up about those things.
Yeah.
What is what's your recommendation for a CERT if one is to become a CERT therapist? How can we help with that?
Well, the way I think about the work of the way a CERT therapist engages with the process is that we also then have to be relationally responsive. So that means that we know from our training and our experience with other clients, we know the kinds of things that are helpful in general, but we have to be responsive. We have to be attuned to our clients. And so if your therapist seems to be responding to you like you're just another checkbox, and maybe let's go right to a solution, that's tempting because we all would like to get better quick. But what you really want is a therapist who is wanting to get to know what your experience is, who can help you see the kind of social world that you have to navigate, the different, and being in my family one moment, being in my military setting another, and that you want a therapist. Therapists are people too. So we've learned these same stereotypes. We're subject to the same kind of ideas about how so we often respond to people differently depending on their gender, their race, their socioeconomic status, and such. And so you want your therapist to have spent time learning to actually go beyond the stereotypes, to take what we call both a not knowing stance, like I don't know what your experience is, but I do know enough, and a knowing stance. I know that what you're going through is not separate from the different roles that you play in your life and the different identities and social messages that have been put on you, and how that's playing out in whatever your clinical symptoms are. So hopefully your therapist, a CERT therapist, would have spent a fair bit of time learning how to do both sides of that. CERT therapists are also, they focus on helping people find their resources, their relational resources, and they're directed toward the future. So we understand the past. We might express over time, as we get to know people, we don't push people to express emotion that they're not ready to express, but we're not afraid to be in it with you. And that can take courage not only on the client's part, but on the therapist's part. That one of my firm beliefs is that we are not just victims of the past. In every new interaction, we all have multiple messages that we've received. We've talked about a lot of them today, the desire for connection and for relationship that gets stamped out, washed away by a larger culture that promotes disconnection. Some of the good things about the military connection is that people do develop connections with each other. So you want a therapist who can help you look at those experiences and then say, what do I want to bring forward? How do I want my experiences to impact what happens next, not only in my life, but if I have children, in my children's life, or even in our society's life? Who do I want to be? There's common myth that therapists are neutral. Like, this is a discussion for another day, but I'll just throw this out there, that what therapists do matters. The kinds of things we focus on, what we talk about, shapes the answers that our clients are going to give. If my client is not feeling safe to talk about their experiences of trauma or whatever it is, what is my part in that as a therapist? That it's not just a resistant client, or, you know, it's like it has to be something that we're in it together. Some of the ideas about professionalism in our society are that, you know, professionals are supposed to be objective, they're supposed to be distant, they're supposed to always have the answers, they're supposed to know what they're doing. CERT takes a little bit different view of professionalism. So you would get a therapist who does know what they're, I mean, they are professional, they are trained, but they bring their heart, they bring their humanness, and their shared curiosity and their willingness to engage with you. But it is a little different way of being professional. And yes, they may invite you to experiment with some different strategies for dealing with certain things, but they don't expect that they know what's best for you until they know you.
Well, thank you very much, Dr. Carmen. This is very enlightening. Your wealth and depth of knowledge is very clear. I'm very impressed hearing you, and I want to thank you for joining us here.
Thank you. And part of the reason that I've been getting more clear is because I'm in the middle of writing a workbook for couples. It's called, at least right now, the working title is Closing the Gap Between the Relationship You Have and the Relationship You Want, a socio-emotional relationship therapy workbook. So in a year or so from today, when we're filming this, that might be out, but it's something that therapists can use to augment their therapy, and people might find helpful as well.
Well, again, thank you very much.
You're welcome.
Thank you very much for joining us.
It was fun. Thank you.